So guys, today we have come to the final part in pancreatitis. Remember, we have part 1, part 2, part 3, and part 4, and this is part 5. In part 1, we talked about pancreas and what causes it to become inflamed. Part 2, we discussed the signs and symptoms. Part 3, we also elaborate more about the signs and symptoms. And part 4, we discuss about what the patient presents with, how it affects the lungs, and how it affects the peritoneum, which make the patient to have peritonitis. So this final part now, which is the part 5, we'll be discussing the treatment and the nursing intervention. So let's start. The treatment of pancreatitis. First of all, you give the patient antibiotics for infection, to help treat the infection, to help combat the infection. Secondly, we give antiemetics for nausea. So we also give antacids. This helps to decrease acid production. Then we'll move on to do ERCP, which is a diagnostic test, and also this test helps to remove gallstone. The gallstone that is blocking the pancreatic duct, ERCP help in the removal of that stone, thereby allowing the enzymes that is produced in the pancreas to flow out. So what are the nursing intervention? First of all, the patient needs to be on NPO, nothing per oral, for at least 24 hours, because eating stimulates enzymes production. Secondly, we need to put in an NG tube, nasogastric tube insertion. This will help to decompress the abdomen, gastric decompression. Third, we need to give the patient IV fluid for hydration, because the patient is going to be on nothing per mouth, oral, which is NPO. We need to give the patient IV fluid to help hydrate this patient. Then we'll move on to opium, help to control pain. So you give the patient opium analgesic to help control the pain, because the patient will be in severe pain. Then monitor for hyperglycemia, because one of the major functions of the pancreas is to produce glycogen and insulin that helps in the blood sugar regulation. So you have to monitor the patient for hyperglycemia. We move on. Monitor the patient vital signs and also monitor the patient electrolytes. The last but not the least, you give pancreatic enzymes before meals. Okay, so what are the diet? There's diet restrictions. What are the diets you are going to give to this patient? You make sure the patient takes diets that are low in fat, diets that are low in in sugar, diets that are low, diets that does not contain alcohol. So you want to restrict alcohol, you want to give low fat diet, and you want to give low sugar diet. So I'm going to do a quick recap here. We're talking about pancreatitis, the treatment, and the nursing intervention. So with this, we have come to the end of pancreatitis. Thank you for watching. Please like my page, share my video, and follow me. Thank you and God bless.